Broadcast, it's taking the world by storm. People are cutting the cord to their high cable bills and moving away from streaming services like Netflix, Hulu, and others for something better. Q Broadcast. For just $60 a month, you'll get access to every channel you could ever want, including HBO, Cinemax, and Starz. And the best part? There are no contracts, no hidden fees, and you're free to cancel anytime. With Q Broadcast, you can enjoy streaming live TV, movies, and top series on up to 5 devices at once. Whether you're at home or on the go, Q Broadcast makes sure your entertainment is always at your fingertips. Imagine being able to watch all your favorite channels from anywhere, anytime, without any restrictions. We're talking about thousands of movies, hundreds of TV series, and a huge library of live channels, all in one place. And don't forget video on demand and pay-per-view events. Those are included at no extra cost, so you'll never miss a big event again. Now, take a second and think about your current cable bill. You're probably paying anywhere between $100 and $300 every month, locked into long-term contracts and hit with surprise rate increases. With Q Broadcast, that's a thing of the past. It's just $60 a month. No contracts, no extra fees, no hidden costs, and no price hikes. Why juggle multiple subscriptions like Netflix, Hulu, and cable when Q Broadcast gives you everything you need in one convenient package? People everywhere are switching to Q Broadcast, saving money and getting more content than ever before. So, what are you waiting for? Click the link in the description and sign up for Q Broadcast today. Just $60 a month, no contracts, no hidden fees. It's time to take control of your entertainment and start streaming smarter.
We live in a world where men are told it's harmless. It's just entertainment. But let's stop lying to ourselves. Pornography destroys. It weakens your spirit. It dulls your drive. And it robs you of what real intimacy is supposed to be. Every click is a step away from the man you're supposed to be. We can't call ourselves leaders if we are slaves to a screen.
As someone that is prior service, I know all about discipline. And discipline isn't out there, it's within your mind. Porn rewires your brain, weakens your will, wrecks all of your relationships. It doesn't just stay on a screen, it invades your marriage, your confidence, and your actual purpose. As men, if we don't learn to discipline ourselves, we'll be ruled by our impulses. Now, it is time to stand up and take control before this silent war takes more than you're willing to lose.
Real men don't hide in the shadows of shame. We step up and we protect what's ours. We fight for our wives and kids, our own hearts. Twitter isn't just an app, it's a weapon. It's a tool used to break free and start living like the man that you're meant to be. The battle's here and it starts with you. You can stop living in shame and you can break free today.
Here at the Anomic Age, we know that these times of uncertainty are stressful. It is incumbent upon all of us to put our fears first and bow down to government tyranny. Gone are the days of freely leaving your home, working, and social interactions. In exchange for safety, we will trade liberty. At the Anomic Age, we understand. However, just in case you want to get off your knees and stop being a sniveling coward, check out the John Age Project at anomicage.com.
Meet Ann Morrissey, who is here with her daughter, Dareth. Dareth is 17 years old. Mrs. Morrissey, I don't have to tell you that most parents would be extremely depressed if their daughter came home one day looking like this. I assume that was your response shock, anger, depression? What was it?
I was extremely angry. I really went bananas.
Yeah, how old was she when this happened?
Possibly 13, 14 years old.
We're talking like it's a disease, isn't it?
Well,
Yeah. How did she explain it to you, Mrs. Morrissey?
there was very poor communication until we went into counseling. And it almost broke up our family. But through counseling and Serena, I can understand it better.
What do you understand?
That she feels like she doesn't want to be like everyone else, and she wants to be her own person. And through the dress code and her lifestyle, she's expressing this. It doesn't conform with our rules, but we're learning to cope, and it's a very, very difficult thing. Extremely difficult.
Dareth, let's let you talk for yourself. You're from Long Beach, California.
I just can't handle being like everybody else because that's what everybody else wants, you know. Just because somebody else does something does not mean that I have to do it. You know, I have my own morals and ideals, and I go by them.
Are you drug-free, Dareth?
Yes, I am.
Is this a political statement, then? Do you have some misgiving about the society that you see?
Yeah, there's a lot of problems, you know. A lot of the people are really aware of what's going on, you know, and I don't like it, you know. There's a lot of problems. I don't like the way society is based.
What bothers you? Give us some of the misgivings you have.
The rich, the poor, the people starving, the wars, you know. Why can't, you know, everybody just get along and just live their life?
Selling real and Chevy.
Propagating truth in a world of lies. You are listening to the John H. Project.
Trust no one. Trust no one. Trust no one.
You found it. You're here. You're headlong down the runaway train that is the Anomic Age, and I am your host, John H., hailing proudly from the coastal plains of the Old North State. I'll be taking you to the dark side of the AM this evening, so thanks so much for joining us. As always, check out anomicage.com. If you've not already done so, please like all the likes, subscribe to all the subscriptions, paypal.me/anomicage, patreon.com/anomicage as well. Those are the best places you can find all things me. As usual, you got the free iPhone app, free Android app, subscribe by email link, and so much more right there at anomicage.com. With any luck, this site is doing a major upgrade, so the site you see on your screen will hopefully be anew by the time you're seeing this tomorrow, but we'll see. Anyway, I won't belabor too many of those points. We have a great guest with us today, so I will jump right into her intro so we can get talking. So we got Dr. Heidi Klessig with us today. Dr. Heidi Klessig attended medical school at UW-Madison, where she completed a residency program in anesthesiology. She received the American Board of Anesthesiologists Board certification in anesthesiology and the ABA's certificate of added qualification in pain management. She is a founding partner of the Pain Clinic of Northwestern Wisconsin and an instructor for the International Spinal Injection Society. Thank you so much, Dr. Klessig, for being with us today.
Well, thank you so much for having me on the program and working yourself through all those syllables. I appreciate it.
Of course. Of course. I was so intrigued reading this because I sort of knew your background, but didn't really know the anesthesiology connection. And it's kind of totally hilarious because in high school, I had a ridiculous amount of surgeries in about a week, and kind of began to know the anesthesiologist. I won't say personally, but I was like, "Oh, it's you again. Nice to see you." Coincidentally, here I am on the table.
Wow.
And actually really looked into being an anesthesiologist until I figured out all that higher math that kept me from getting into those classes. But I definitely wanted to pursue that at one time. So that's really interesting. I love it.
Well, I'm glad you had a good experience with your anesthesia, obviously. That's super. I hope you're doing well health-wise too, right?
Yeah. Well, they gave me a gas during the first surgery, which was not good. That made my stomach upset and everything went not good. But I think the other two were all IV. So gave me a real aversion for IVs.
Well, yeah, we individualized trying to make everyone comfortable. So I'm glad they worked it out for you.
Yeah. So she was a nice lady. I don't know where you are, but thank you if you're listening for changing things, at least a little bit for the better on that litany of procedures there. But anyway, thank you so much for being with us. As usual, thank you so much for your time. I know everybody's kind of pressed for time in today's society, so thank you.
Well, this is an important topic. It's worth taking our time because this is an issue that has been flying under the radar for nearly 60 years. And whereas there's a lot of movement in academic journals, doctors, lawyers, philosophers, scholars have been fiercely debating the legitimacy of a lot of organ harvesting ideas and practices. The public is never informed. I mean, the public just goes to the DMV. They ask you without any type of information, do you want to be an organ donor? And you look at the brightly colored posters that encourage you to be a good citizen and sign on the dotted line. And people say, well, yeah, if I'm dead, why wouldn't I be able to share parts of my body with others? But the devil is in the details, and that's what we're here to talk about today.
Absolutely. Well, what got you down this trajectory? I guess we got to start at the beginning. I know certified anesthesiologist, MD, the whole 9 yards. And then, what were some of these, I guess, proverbial chinks in the armor that made you go, oh, well, this isn't really as advertised, or this isn't really what I signed up for? Because I think it's kind of weird. A lot of people, probably really good-hearted people, go into medicine, go in medical school and, think, all right, I'm going to help people and so forth and so on. But to me, I think one of the big disconnects between, I guess, the common person going in there and the people in the medical industry, and I draw those same parallels in academia, by the way, it seems like for whatever reason, people kind of lose that soul. They lose their heart, and they start looking at people like numbers and procedures rather than, man, this is somebody really going through a life-altering ordeal here. Let's give them some time. Let's give them a little space. I know this room's like $30,000 a minute or whatever it is, but how'd you get in there from the traditional medical tract?
Well, I came to this sort of unexpectedly. So just, like anyone else, I was that, the bright-eyed young kid that thought she'd want to be a doctor and wanted to do a good job. Got through medical school. I love learning new things. I thought that was so amazing to be able to have that experience. And then I went into my anesthesiology residency training program. And one night during my first year, I came in for night call and reported to the operating room desk for duty. And the doctor running the OR schedule there said, "Oh, Klessig, glad you're here. We want you to go up to ICU. There's a brain dead man up there. We want you to bring him down and give him anesthesia for organ harvesting." And it kind of took me aback. I wasn't really expecting that. I sort of remembered hearing a lecture somewhere along the line about brain death, but I didn't really have all the information right at my fingertips. So I asked him, brain death, huh? I said, is there anything different about this case that I should know? You know what, John? He laughed and he kind of rolled his eyes and he said, just be sure someone has actually declared him brain dead. You know how eager the transplant service can be? Not what I wanted to hear. So I went up to the ICU and found my patient, and he was a young man. He was about my own age at the time. He had been in a motorcycle accident, and he had a severe head injury. And yes, the neurologist had checked all the boxes on the brain death protocol and said this man was dead. So I went in to see my patient, and you know what? He didn't look dead. I mean, he was warm. He was pink. He had great blood pressure. He had good heart rate. He had nearly 100% oxygen saturation in his blood. He wasn't on much for drips or infusions. He looked like every other ICU patient I'd cared for. And in fact, he looked better than most. He was more stable than many of them. So I took these facts back down to the operating room, and I found the attending anesthesiologist who was going to be supervising me for the case. And I presented the patient to him. And he said, okay, well, what's your anesthetic plan of care? I was pretty brainwashed at the time, so I figured, this must be a real thing. So I said to him, I'll give the patient a paralyzing drug so he doesn't move during the surgery and upset the surgeons and what they want to do. And I'm going to give him fentanyl, which is a potent painkiller to blunt any heart rate or blood pressure swings that might damage the organs. And he said, okay, are you going to give him a drug to block consciousness? And I was stunned. I asked him, I said, why would I do that? Isn't he dead? Yeah. And he just gave me this long look over his surgical mask, and he said, why don't you give him a consciousness blocking drug just in case? And he walked away. Well, John, I'll tell you, that didn't make any sense to me. But, to my shame and regret, looking back on it, I caved under the pressure. I mean, I was being trained, and everyone else seemed on board with this. And they're all, like you say, the $30,000 an hour operating room was waiting on me to get going and bring this guy down because people had a project to do. So I brought the young man down. I gave him the anesthetic that we had proposed. And I'm here to tell you he reacted to the incisions, to the bone saws, to the organ retrieval, just like any other patient. He required the same types and amounts of anesthesia as anyone else. And in retrospect, I'm quite sure that I participated in a medical homicide. That man was fully alive. His spirit was, by all intents and purposes, still in his body when we started. When we were done and he had been medically dismembered, the man certainly was dead. And this really bothered me. It bothered me. But I kind of went on with my career thinking, well, this just doesn't make sense. But doctors are really, doctors and nurses both. And I want to sort of encourage you, if you're a doctor or nurse listening to this, doctors and nurses are responsible for such a vast amount of information. There is no way possible that we can individually research everything we are taught. We're kind of forced to take a lot on basis of the authority of the people who teach us, who took it on the basis of the authority of the people who taught them. But, later in life, when I had more time, I made it a project to look into this brain death idea and to read the primary source documents. And really, I was hoping to justify what I had done. I figured I must be missing something. I mean, everyone's going along with this. There must be more to it than I understand. Mm-hmm. But the more I researched and the more I learned, it turns out there are no scientific studies, facts, or evidence that brain dead people are dead in the sense that they are like a corpse, that they're beginning to decompose. I found out that there's a lot of debate in the medical literature that's been going on vigorously for the last 50, 60 years between the academics, but the public has not been informed. And so the more I studied it, the more I realized that this is a real problem because people are being asked to sign up to be an organ donor with absolutely no informed consent process whatsoever. And I think that's unjust. I think it's unjust that people in the scholarly world are allowed to question and debate whether this is an ethical, moral, scientific enterprise or not. But the people actually being asked to give their loved ones to become organ donors are not being told. And so that's why I wrote a book, The Brain Death Fallacy. That's why I have a website. That's why I have a social media presence, just to raise awareness. Because I think the lack of informed consent for public people being asked to become organ donors needs to be a part of the pie. Why can't the public have a seat at the table in this debate?
And one thing that really kind of vexed me when I was looking into this, and even talking about this with Mr. Shera the other day, was, people are doing this consent, quote unquote, when they're like 16 years old. Like you get your license, you're 16. Like I didn't have the mental faculties to decide a flipping paint color at 16. But yet, everybody's at 16, you can't vote, you can't smoke, you can't go off to war. Like this litany of things that the proverbial they have deemed you incompetent to do, rightly so. You're giving your organs. You're basically signing your own death warrants in many scenarios at 16. And then I think a lot of people just kind of, okay, well, I made this call at 16, and here you kick the can down the road 30, 40 years later when some of these things might be more applicable. The devil's in the details. Like you said, I think the devil in the details really does haunt a lot of people predicated on decisions they made woefully ignorant, if not incapable of making even at the time.
Well, and interestingly, most people are not aware that the signature on a donor registration is considered legally binding. Your organs will be taken. I mean, even over the objections of your spouse, your family, your healthcare surrogate. Without a court order, nobody can stop that signature that you gave when you were 16 and maybe just continued to renew with your driver's license as the years went by. A decision that was made with absolutely no informed consent. Organ procurement organizations have successfully sued in court and removed people's organs over the objections of their family because they were a registered organ donor.
Let's underscore that a little bit, because I don't think people fully grasp that. So if you're married to someone, they fall off a ladder and bump their head, they go into I suppose some sort of vegetative state where they're unconscious or what have you. Then the medical mafia can swoop in and basically say, all right, well, shoot, look at the clock here, look at the time. She's been there for 2 days now, Bob. You sure you don't want to? Well, holy cow, look. She made this decision at 16. You're out of the picture, Bob. See you later. We're going to go ahead and do what we got to do here. Is that really what's going on?
That does happen because, brain death was originated back in 1968 by 13 men at Harvard Medical School. They wrote a landmark paper in the Journal of the American Medical Association called A Definition of Irreversible Coma. And in that, they never said that people in a coma that doctors deemed it in 1968 to be irreversible were actually dead. They said these people were desperately injured, and they deemed that these people's lives were, and I quote, a burden to themselves and others. And they went on to say that if we would simply redefine comatose people as being dead already, it would have the important social utilitarian values of freeing up ICU beds and removing the controversy over using comatose people as organ donors. Comatose people make excellent organ donors. For one thing, as you point out, they can't object. The other thing is their heart is beating, their lungs are absorbing oxygen and releasing carbon dioxide. The rest of their body, the organs are kept in tip-top shape. So brain death became, the first way of becoming an organ donor. In the early 1990s, in the continual quest for more donatable organs, they actually started taking another class of people who were not brain dead to be organ donors. And that's sort of the class you were bringing up, people who have a poor prognosis and are not expected to survive. They do approach the families of these patients also, and they say, you don't want your loved one to suffer. We don't think your loved one has much chance of having much of a meaningful life anymore. Would you like to have their support terminated in a way that allows for organ harvesting? And this is called controlled donation after circulatory death. So the death becomes a controlled event, a death scheduled to take place at a operating room where organs can be removed. And this is a really sketchy process also. The patient is taken to the operating room, their ventilator and support is withdrawn. They allow the heart to stop. Once the heart stops, doctors wait 2 to 5 minutes to be sure the heart doesn't resume beating spontaneously. it sort of depends on your geography, whether you're dead or alive at this point. In my state of Wisconsin, it's 2 minutes. In other state, it's 5 minutes. After the 2 to 5 minute wave off period, surgery begins immediately to get those organs. But the problem with this is, it's very routine to be able to resuscitate someone who has just had 2 to 5 minutes of pulselessness. And if you could still be resuscitated, you were never dead. And what's been happening is these people, when surgeons go in to procure their organs, a lot of them are found to have a beating heart or to have resumed breathing and are not dead in any sense of the term. And so this is another problematic practice. Brain death being one, controlled donation after circulatory death being another. I could go on to worse, but maybe I should take a pause and let you interject.
Yeah, I mean, that's just so deranged, because I think a lot of people think this is decided science, to draw a lot of parallels between some of this stuff from the last few years. But this sort of definition's only been around since 1969. And everything you just told me, a lot of this language of burden on the society and all this sort of stuff. I mean, first, it draws a lot of parallels between movies like Soylent Green, from the 70s, but I guess a bit more scientific, it draws a lot of parallels to eugenics to me, where they're going, a lot of the same language. Well, this person's going to be a burden on society. This person's, and they use all this lovely feathered language to classify people as moron and mongoloid and all this stuff. It sounds very reminiscent of just, we just don't want you around anymore. We can do better stuff with your organs. We don't want you to be a burden in this X amount of dollars bet a day when we could probably peddle your goods somewhere, make some profit on this thing.
Yes, you're right. And so brain death is perhaps a prognosis of possible death, but these people aren't dead already. And as you point out, the science is certainly behind saying this is a prognosis. There's only been one multi-center prospective study of what is the actual pathology of the brain in someone who has been declared brain dead, right? So this was done back in the early 1970s. Between 1970 and 1972, the National Institute of Communicative Disorders and Stroke did a multi-center study of people declared brain dead. Now, back then, they used stricter criteria than what we use today. But under even those stricter criteria, they got 226 brains to autopsy. And if these people were brain dead, you would expect to see that all those brains were destroyed, right? Well, no, that's not what they found. They found less than half, 40% of the brains showed diffuse tissue destruction. 10 appeared grossly normal, and the rest had scattered small problems. So the authors of the study said that this brain death idea is a prognosis. Dr. Gaetano Molinari wrote, "Does a fatal prognosis permit the physician to pronounce death?" He said, "It's highly doubtful whether such glib euphemisms as 'he's practically dead,' 'he can't survive,' 'he has no chance of recovery anyway' will ever be acceptable legally or morally as a pronouncement that death has occurred." But despite Dr. Molinari's doubts, we all know that it has been accepted both legally and morally as a pronouncement that death has occurred. And in 1981, a President's Commission was convened, and they decided that this brain death would be a okay thing because the testimony they received based on the data in 1980-81 was that once the brain stopped working, the heart would very quickly stop as well within, days to maybe a week or two, right? So they thought this prognosis of death was good enough. If your brain's not working, the rest of you is going to stop working anyway. Why don't we just call you dead now and get those viable organs? Mm-hmm. That, again, a prognosis of death was palmed off as death itself. And that's completely unscientific and it's unjust.
And you've mentioned this a little bit, but let's delve into that some. Like, what are the different ways that death is prognosed? I suppose. Okay. You've got the brain death, and I think you've got pulmonary, and the whole nine yards. But shouldn't there be like a universal? This is it. and it seems to be several different whack-a-moles you can hit to get that justification to take organs.
Sure. If you think about it, for thousands of years, you did not need a doctor to tell you if someone was dead or alive. I mean, people could recognize death at home, on the farm, on the battlefield. They could see that usually they would use the three criteria. The person was not breathing, they had no pulse, and enough time had passed to be sure that these things weren't going to return, right? This is where our traditions of the vigil, the visitation, the wake all come from, so that people would have, number one, time for grieving, and also time to be sure that your loved one had indeed passed away. I mean, you may have heard in the 1800s, savvy entrepreneurs came up with the idea of the safety coffin, right? Because they had a fear of being declared dead prematurely. They'd hook up a little bell rope, and if you were buried too soon, you could ring the bell and they could dig you back up again. But with the idea of organ procurement, now instead of standing back and being very careful that no mistakes are made and death isn't declared too quickly, now we declare death as quickly as possible for the sake of those viable organs. The newest American Academy of Neurology brain death diagnosis guideline allows brain death to be declared 24 hours after injury. Now think about that. If you've had an injury, do you think 24 hours is enough time to be sure you're not going to recover? I mean, think of a brain injury. Your brain, of course, is enclosed in a rigid skull. It begins to swell. The skull contains that swelling and increases the pressure on your brain. Do you think working to decrease brain swelling and pressure for 24 hours is enough to be sure you're not going to recover? I mean, John, have you ever had a sprained ankle? Have you had a sprained ankle? Does the swelling go down in 24 hours? No, of course not. But now there is a big hurry, which is being driven by the desire for these organs. And I think it's divided doctors' loyalties. In the past, doctors were all for the patient. We were supposed to be 100% involved in protecting and preserving our patient's health. But now with the advent of organ donation, doctors' loyalties are divided. There's the good of caring for the patient, and there's the good for society of providing organs. But you asked about the how is brain death declared. So the way it happens is that you have to have a coma of known origin, and you have to exclude confounders. The patient shouldn't have drugs in their system. They shouldn't be too cold. They shouldn't have electrolyte derangements. And then what they do is they check 4 basic pillars. First, they check if you are unresponsive, right? Mm-hmm. Unresponsiveness is not the same as no inward awareness. So inward awareness is a first-person experience. You can't tell what I'm thinking. I can't tell what's going on in your head. Doctors have no way of knowing if a person is inwardly aware. We can only test whether you're willing and able to respond, which is not the same thing. I mean, there have been reports of patients who were sort of locked in to themselves. Zach Dunlap is a famous case. He was a young man who had a severe four-wheeler injury with a head injury, including brain matter coming out of his ear canal. He was very severely injured, and he was declared brain dead. But he recalled later, after he recovered, he related that he could hear every word as doctors told his parents that he was dead and he could become an organ donor. And he said, there was nothing I could do. I couldn't move. I couldn't sign. I wanted to scream. I wanted to shout, but I couldn't do it. I just got extremely angry. Thankfully, Zach's cousin managed to get him to make a purposeful movement just as the helicopter was landing with the team to take Zach's organ. Zach goes on and made a full recovery. Now he is married. He's got a little girl. He works a job. So again, it's a good case in point to show that the inability to respond is not the same as the lack or loss of inward awareness. The second pillar of the exam is that you cannot move in response to a painful stimulus. But as I mentioned, the guidelines back in 1968 they required no movement of any kind whatsoever, no reflexes of any kind whatsoever. But over time, this has been loosened up. So now you can have spinal reflexes and be declared dead. There are also certain movements that are allowed. You're allowed to raise a limb off the bed, an arm or a leg. You can reach up towards your endotracheal tube with two hands. I mean, it's basically, it looks like the universal sign of choking, but they'll say they call it the Lazarus reflex. So it's indistinguishable from purposeful movement. And they also, this is my favorite one. They say if they brush your nipples and you open your eyes, that's a reflex too. What on earth, right? So the guideline actually does acknowledge that this is somewhat subjective. The guideline, and I quote, says, it can sometimes be challenging to determine whether a movement is cerebrally or spinally mediated based solely on clinical examination. And the guideline goes on to recommend that if you're not sure if your moving patient is dead or alive, you should ask a friend. They recommend asking a colleague. I mean, it's very subjective. And then the third pillar to go on is it is, if it wasn't so gruesome, right? It's very grim, but it is ludicrous. The third pillar is the neurologic examination. And according to the Uniform Determination of Death Act, to be declared dead using neurological criteria, you must have the irreversible cessation of all functions of the entire brain, including the brain stem. But the neurologic exam does not test all functions of the entire brain, including the brain stem. It checks 4 or 5 brain stem reflexes. They check if your pupils respond to light. They check if you cough or gag. They shoot some cold water in your ear canals to see if it makes your eyes turn funny, and they turn your head to see if your eyes track a certain way. And that's it. I mean, that's certainly not all functions of the entire brain. Moreover, in contradistinction to the law, the newest American Academy of Neurology brain death guideline explicitly allows death to be declared in the ongoing presence of brain function, the function of the hypothalamus. Now, I said a minute ago, the law says that you have to have the irreversible cessation of all functions of the entire brain. But the way doctors diagnose brain death, the guideline explicitly allows that you may have a function in part of the brain called the hypothalamus. Now, is the hypothalamus so critical? Well, it's important for maintaining your blood pressure, which is kind of important. And it also mediates sex drive, awareness, and pain. I mean, you tell me, those sound like important brain functions to me, but the guideline allows people to be declared quote unquote dead while they still have those functions. And the fourth pillar would be the apnea test. The apnea test, it's to see if the person will breathe spontaneously. So what happens is the person is disconnected from their ventilator and they're observed for spontaneous breathing. And the guideline gives, parameters on what sort of oxygen and carbon dioxide tensions in the blood there ought to be to make this a valid test. But if you read the fine print, they say selection of targets for this challenge is arbitrary because they have no scientific data to demonstrate what parameters would cause breathing if respiratory centers were functional. This is not science. And if you look even at the first page, and I show this slide quite frequently, the first page of the brain death guideline and the method section, they say, and I quote, because of the lack of high quality evidence on the subject, an evidence-informed formal consensus process was used to make this guideline, meaning they did it by 3 rounds of anonymous voting. Now, John, think about it. We have been declaring people to be brain dead for nearly 60 years. Would you not think by now there would be some high quality evidence for it? But they admit straight up, there is not. Brain death remains what it was from the beginning. It's a utilitarian social construct engineered to procure viable organs.
That's just totally insane. You got me at phone a friend, basically. You got the phone a friend option, and then it's completely arbitrary. I mean, good grief. It sounds like we have more hard and fast rules for just your average car than we do for humans, because GM's not going to say, well, the compression rate's arbitrary on this. That's insane. That's not even feasible for basic automotive function here.
No. And we talked a bit earlier about the controlled donation after circulatory death and some of the problems with that. Controlled donation after circulatory death, or DCD for short, actually is banned in many European countries because they realize people are eminently resuscitatable 2 to 5 minutes after pulselessness. And so these people are not dead. I mean, countries like Finland, Germany, Hungary, Lithuania, Turkey, Bosnia, Herzegovina have all banned this because they know these people are not dead. Germany will not even accept organs from one of the biggest European transplant providers, Eurotransplant, because some of them may have been procured in this way. They find it ethically too problematic. And as I mentioned, it sadly does get worse. There's a procedure that is sort of a spin-off of the controlled DCD donation called NRP. We use these acronyms because of the multiple syllables. NRP stands for normothermic regional perfusion. This technique was originated because we want to get more hearts, right? But if we let you become pulseless, your heart is going to have been stopped so long that it probably isn't in really good shape, not good enough to put into someone else. So they came up with a new way to try to reboot the heart and to improve its condition. So in this variation, they let your care be withdrawn. They give you the 2 to 5 minute wave off period, and then surgery begins with clamping off the circulation to your brain so they can do a full resuscitation on the rest of your organs, such that your heart starts beating again in your own chest to see if it's in good enough shape to put into someone else. So this is incredibly problematic. In fact, the American College of Physicians, the world's largest specialty medical organization, called for a pause in NRP in 2021 because they did not think the ethical and legal propriety of the practice had been met. Of course, their pause has fallen on deaf ears. To walk you through it this ethically and legally, here you have someone who is not brain dead. They have their care withdrawn, their heart stopped. So now legally their death has been declared under the cardiac arm of the Uniform Determination of Death Act, which says the irreversible cessation of heart and lung functions. Then, because they're going to restart the supposedly irreversibly stopped heart, right? Then they clamp off circulation to your brain. So now they've made you brain dead on purpose. So now legally your death is being declared under the neurologic standard, the irreversible cessation of all functions of the entire brain, including the brainstem. So now when they restart your heart, they're covered legally, you're still dead. They've just switched the definitions of death a few times in mid-procedure. I mean, who would consent to this? Would anybody, if a doctor explained that I'm going to take your child, your mother, your brother to the operating room and do this? Nobody would consent to these things. But this is what's going on behind operating room doors today.
I mean, I can't think of another word except just ghoulish. This whole thing, it makes a horror movie look like a walk in the park, man. I couldn't even imagine, like you just said, well, they basically shut off your brain so they can declare you dead. And then we're going to just proceed with the removal of organs for the highest bidder. I mean, it's totally insane, man. Good grief.
It is. And, I made a post yesterday on X about the honor walk. If you want to think about that, the honor walk, some people call it the horror walk. What they want to do is they want to get the family involved, consenting in sort of a celebratory way for this. So as you recall, during my story, I brought the patient down, here from the ICU. I had to use a bag and breathe for him. I had a monitor so I could watch his blood pressure and heart rate. These people aren't dead. They didn't do honor walks back in my day. But now during that transfer, they get hospital staff to line up and stand at attention while this person goes off nobly to become an organ donor. And, so I asked on X yesterday, I said, if I asked you to picture this, a helpless victim is being sacrificed for the good of society. I mean, do you think of a Mayan temple? Do you think of a virgin being thrown into a volcano? Or do you think of this honor walk? I mean, here we all are watching this soon-to-be sacrificed person to give those organs for society. I mean, the parallel is exact. It's a gruesome ritual of human sacrifice, if you will.
It sure is. I mean, that's exactly what I was thinking when you were talking. I was like, we're at the top of Templo Mayor. We're about to disembowel this person, rip out their heart, and hold it up for Quetzalcoatl and throw their body down the stairs. I mean, good grief, man. That's just...
Dying for the benefit of society is what it is. Now, there may be people who would consent to that, but I think by and large, that isn't something most people would like to see happen. I mean, basically, these techniques are all concealed forms of euthanasia. I mean, these people are being purposefully taken apart to their demise by doctors. I mean, that is active euthanasia, but it's being concealed. The public is never told. It's being sort of papered over by these very wishy-washy diagnoses, slippery language. And I think that's wrong. I think we should speak frankly and let people make their own decisions about this.
And there's a couple different directions we can go on this one. I got to at least throw this one out there, though. I can't help but think the media really does shape public perception so much. And I've been thinking about this for years. It seems so ironic to me, like my entire life and yours and, 1,000 other people's, there's some big medical drama every generation. I was thinking there's one in the 70s, the Trapper John and goodness, ER and Grey's Anatomy. There's always one for every generation. And I swear, I think that's where most people get their programming and they get their norms and they get the this is a virtuous act. Remember I saw it on ER. Remember I saw it on Grey. It's like they get this sort of programming and they don't really know the legality nor the reality of what's actually going on. They're just kind of going along with the quote unquote show. But it's, from everything you're saying, it's not like that. This is not like on TV where everything's wrapped up in 30 minutes and, oh, it was a virtuous act. We did away with grandma, but somebody got an eye out of it. It's like, it's so different than the reality of it. I mean, maybe I'm just kind of searching there, but I think that's nuts.
No, you're absolutely right. And I think the thing is, once you see through it, you can't unsee it. I mean, it has been papered over. I mean, we pay with our tax dollars for public service announcements saying become an organ donor, without any type of factual information being given. And that what you're talking about when people make this decision, I mean, they're being emotionally manipulated into doing something that probably they wouldn't do if they had more information. And that certainly is wrong. And that's what I'd like to see change.
Is there a behind the curtain? I know that there is, as far as just the industry of this whole thing, because I cui bono, who benefits? I'm following the money here. I can't help but think these hospitals are getting some money from this. These organs aren't just getting doled out for free. Another one that I was just pondering is like, where does all this stuff go? Because I think the average person is kind of that out of sight, out of mind thing. Nobody even knows how many organs are donated. Is this a multi-billion-dollar industry? I'm thinking, I'm sorry, I'm throwing a lot of questions out here, but that's kind of a lot coming.
No, that's a very reasonable question. And I have to admit, in the past, I have sort of shied away from talking about the dollars and cents because I think most people who are really pro organ donation do it out of a sort of a misguided sense of zeal. Because we have compassion for people with organ failure and we would like to help them. And I would like to find better, more ethical ways to help people with organ failure. But, when I was on Scott Shara's podcast, he had another guest whose mother-in-law sort of very quickly became an organ donor. The family kind of got sucked into this and then later thought about it. And one of the things that really bothered that family was when they found out the dollars and cents their mother-in-law's body could be marketed for when they had given it away for free. So since then, I do take more of initiative to let people know about it because it mattered to that family and it probably would matter to others. So I have a graphic that you can see on my website. There's actually a button on the homepage that says, "What is the human body worth?" We reference the Milliman Company, and just this year, we've turned over the calendar. Just in 2025, they came out with the U.S. organ and tissue transplants, costs, utilizations, issues, emerging solutions. And they have a chart. And if you take a look at it, if you look at, say, we just gave away the heart, the intestine, the liver, two of the lungs, a pancreas. If you just do those, that's over $8 million in billable charges just for those. And that doesn't include the tissues, things like corneas, heart valves, skin, bone, certainly can be marketed for more. But yes, if you add up the transplant industry based on Milliman's numbers last year, it's over $60 billion a year industry. So the money certainly isn't nothing. It does play a role.
Yeah, I was putting that chart on the screen there for people to see. That's just mind-blowing.
Mm-hmm.
And you're so right. Go ahead.
Mm-hmm. Well, I should bring up, Interestingly, I'm not against all transplant. I'm just against unethical transplant. And when we look at these charts, it does bring up the distinction between organs and tissues that I just mentioned. Organs, the things like the heart, the lungs, the liver, the kidneys, very quickly begin to degrade in the absence of circulation and become unviable for transplant, not suitable for transplant. Mm-hmm. Whereas tissues, the things like the skin, the bone, the heart valves, the corneas, are much more resilient and actually can be donated from a biologically all dead body, someone whose spirit has gone to heaven and they're just a corpse. Nevertheless, I recommend that nobody be a registered organ donor, even if you're just thinking, well, I'd like to give my tissues after I'm all dead. And here's the reason why. As I mentioned, if you are a registered donor, these things will be taken, and they will be taken promptly. And there was an interesting article in the LA Times a few years ago saying that death investigations had been upended because organ procurement, tissue procurement was allowed to proceed before a coroner's autopsy. And what happened with this, there was a family whose son was working out with ROTC and he just collapsed and died. He was taken to the hospital. It was too late for him to donate any organs, but organ procurement, because he had registered as a donor, was allowed to take his tissues, including his heart valves, before the coroner was able to evaluate why on earth this young man had died, leaving his family with absolutely no closure. I mean, they actually begged the organ procurement team, please don't take anything until we know why John died, and they were denied. And this was heartbreaking for them. There was another case similar to that. It was the daughter of former Major League Baseball player Merv Rettenmund. His daughter Christy came into the hospital after being apparently badly beaten. She was in a relationship apparently with someone who'd had previous domestic violence accusations. But because Christy was a registered donor, I mean, her body was pretty much stripped, so that by the time the coroner got a chance to look at her, I mean, he couldn't check for bruises because the skin was gone. He couldn't check for broken bones because the bones were gone. There was not enough material left for the coroner to be able to say she was or was not the victim of a homicide, leaving her family without justice. These are serious issues. And so again, even though there may be good ways for you to donate tissues ethically, I recommend not to be registered so that this will not happen to your family. If you want to donate your tissues, just tell your family that you want to do that after all their questions are answered as to your cause of death, after they're sure your death was not the result of a crime. They can release your body to have corneas taken or whatever. That would be fine. But there are these caveats.
It's just so... I think it's kind of like I was saying before. It's the thing that people think is like this benevolent love association that's just there for your benefit and health. And then there's the reality of it. And it's like everybody's tapping their watch going, we got to get this guy out of here. We got to get this lady out of here. It's beyond the pale. I would never think that they wouldn't do an autopsy because, we got to get these valves. It's just so beyond the pale to me. It's nuts.
Yeah, it's surprising once you take a look at it, really how deep the rabbit hole goes, and then I haven't even begun to talk to you about what happens in communist China, where they are taking organs from prisoners. They're actually executing prisoners of conscience for their organs. Transplant tourists fly in from all over the world on the day the prisoner is executed to receive their organs. I mean, the more you look at this, the more heartrending it becomes.
Yeah, I mean, that's kind of what I was going to get into next. You were reading my brain there. But, I think a lot of people know the Falun Gong as, the main people of interest, I suppose, in China because of their health and abstaining from bad things and so forth and so on. But, like you said, there's a whole tourism industry just predicated on organ trafficking, harvesting, murder. I mean, there's no clean hands in this whole thing, it seems like. And that's another thing I don't think most people even understand. I mean, just on a cursory level, I know when I've looked at this stuff in the past, I'm like, who in the world's going to Thailand to get a kidney? Like what? I was just so like beyond the pale for me to even think about, but it happens. It's not a cheap industry, I'm sure, but that's not something that's out of the ordinary for a lot of people, I suppose.
Yeah, no, it is absolutely documented that what's going on in China is the abuse of prisoners of conscience, not even just the Falun Gong anymore. The Uyghur Muslims now are being targeted for this. There's been reports that now it's moved on to house church Christians. Just in the last couple of months, there's been reports coming out that parents in China are keeping their children home from school because the children are being blood tested and health examined, and some of them are being sort of erased. They're being kidnapped from school, and no one can find this child again. So parents in China now are worried about their own children this way. Yanya Kielik from the Epoch Times and American Thought Leaders actually has a new book coming out on what's going on in China. I think it comes out next month. I'm fascinated to read it because I know he's done an excellent job looking at this. But the idea of having people being, snatched off the streets in China for their organs is horrifying. You bring up other countries. I mean, organ trafficking has been estimated to be for kidneys, about 20% of kidney transplants are supposedly coming from trafficked organs, where an economically disadvantaged person in a second or third world country is offered, a measly $1,000 for a kidney that then is sold to a wealthy Westerner for way more than that. And, this poor donor often, is not well cared for afterward. A lot of them, have complications. They are unable to work afterwards. That $1,000 goes away pretty quick. But there are whole communities in Afghanistan that are known as kidney stands because everyone has that scar on one side of their abdomen. They're so poor they've all given a kidney.
This is so nuts. I never knew about the kidney stand thing. Good night, man. That's insane.
Well, so we need to come up with better solutions. To give you the good news. Okay, let's talk some good news. We need, first of all, to have full transparency and fully informed consent, so people can understand what the issues are and make good informed decisions for themselves and for their loved ones. We need to give people some mercy. I don't know, after 60 years of having this system in place, if any of us truly have not been touched. I address doctors and nurses and how we've been trained to think a certain way that needs to be revisited. I also try to reach out in mercy, to people. Say you've given a beloved family member to become an organ donor in the goodness of your heart, right? It's not your fault that you were never given the facts. You were not given fully informed consent. You did the best thing you could do with the information you had available at the time. And if you received an organ, I am glad you're here. I mean, it's It's not your fault that the organ that you received may have been procured in a way that violates your conscience. Again, you were told that this was the best thing to do, and with the information you had, you acted in the way you thought proper. But this information is available, and it needs to be more fully available for the public. And we need to come up with better solutions. I mean, really, I'm a big fan of living organ donation, in which both the donor and the recipient remain alive after the procedure. And this doesn't even have to be a family member or relative. I worked with a nurse who received a kidney just from a selfless person who wanted to help someone in need and donated a kidney. And both she remained alive and my nurse remained alive after the procedure. So these things can be done for almost any organ. And of course, we only have one heart and we can't give that to someone else. But the good news is there's a completely implantable artificial heart currently in clinical trials. So I think if we weren't pouring all of our research dollars into this unethical system, we would have developed much better options for people with organ failure by now, and we need to continue to pursue that. I think if we weren't writing off all the most difficult neurologic cases to become organ donors, we would have better solutions for people with neurologic injury. I mean, frankly, what if in 1968 we had decided that heart disease or cancer was just too difficult and just decided not to even try? Where would we be in the treatment of cardiac disease and cancer? I think we're 60 years behind where we should be in the treatment of neurologic injury. So I think, shining the light on what's been going on is going to be in the long run very good, very helpful, very productive in coming up with better solutions.
That's so true. Mm-hmm. This might be in your book, forgive me if it already is, but is there sort of like a crash course that people need to, I was thinking of this along the lines of like parallels of like having a will, having a will, you're thinking, okay, at some point I won't be around. Let's put the house in this person's name and the trust and so forth and so on. But this sort of thing, I don't think most people really look at, or if they do, they don't look at it hard enough, because a lot of this information, they just don't know. So is there sort of like a crash course of, we need to talk to mom and dad, we need to talk to the kids and make sure that they know, hey, if I get hit in the head by a coconut, I don't end up, in some sort of Twilight Zone episode, quote unquote, brain dead, being ripped apart here. And also with that, questions or things that people need to ask or make sure that are answered when they get in these situations, if they have a loved one in this situation.
Sure. So that's why I do what I do. So if you would go to my website, which is www.respectforhumanlife.com, there's a lot of information that you can kind of skim over and see what you need to find out very quickly. I also have a YouTube channel at Heidi Klessig, MD, where I have several short videos, 5 to 10 minute videos, easy to understand, made for the public, addressing things like brain death, controlled donation after circulatory death, NRP, tissue donation. Should I donate my whole body to science? I mean, just all these end-of-life things that you can watch a 5 to 10 minute video and get a lot of information to help guide your thinking. The book, the brain death fallacy, is if you have a scientist, a doctor, or a nurse in your family, this book is fully referenced. You can see all the primary source documents. You can do a deeper dive and find out more if you are more scientific or medically oriented. What you bring up about end-of-life documentation is very important, and I think people should be aware of that. On the website, there's a button that says, "How do I get off the donor list?" And if you push that, you'll find that you can have resources there from our sister organization, the HALO organization, that has an addendum for your healthcare power of attorney, talking about how you are not interested in having some of these procedures performed on you or being declared dead by these neurologic criteria. You will also find a wallet card. And you would think, well, why do I have to carry a wallet card? Well, there's another funny law that was passed called the Uniform Anatomical Gift Act. And most people think in the U.S. we have sort of an opt-in system that you have to decide to be an organ donor. And if you've signed up, then you're an organ donor. If you've never signed up, then you're in the clear. Strictly speaking, that's not fully true. So the Uniform Anatomical Gift Act states that if you come into the hospital and you're incapacitated and your family cannot be found in a reasonable amount of time, the hospital administrator is empowered to donate your body or organs on your behalf unless you have a specific refusal. So it's important to have a specific refusal documented somewhere. So I recommend that when you go to the clinic, you ask the nurse to type into your electronic medical record that you specifically refuse to be an organ donor, if that's your choice. The reason this can be a problem, there's an actual court case going on right now in New York State. An elderly grandmother, her name was Miriam Hoyos de Baldrich. She wandered away from home. She unfortunately got hit by a subway train and was taken to a hospital. And the family says she had information in her pocket that would have identified her. The family also filed a missing vulnerable adult police report. Yet the hospital said they couldn't identify her. They couldn't find any family in a reasonable amount of time. And Miriam died by organ harvesting. And her family is suing. But with the way the language is in the Uniform Anatomical Gift Act, I don't know how it will turn out. But you do need that specific refusal documented, at least in your end of life documents. Probably a really good idea in your. I'm just sorry, it just went right out of my mind.
No, that's fine.
Documented in your phone, with your wallet card, and in your electronic health record. Thank you. So these are things that people can do to help protect themselves. It's difficult to actually remove your name from donor lists. So I recommend you go to the Department of Motor Vehicles and you get that taken off of your driver's license. But there's also a link on that button I told you about on the website to the National Donor Registry. If you're sure you never have registered, I would not push that button. So I just thought, so many people ask me how this process works. Yeah. I'll go into the National Donor Registry and see if I'm an organ donor. Well, the way it works, once you type your name in, you get an automatically generated email. Thank you for becoming an organ donor. And now you have to unsubscribe, but they didn't send me any confirmation that I had unsubscribed. So I have an email address, so you can actually email them and say, please send me confirmation that I am off your list. And they will send you confirmation and a screenshot that you are off the list. So it's sort of like the Hotel California, right? You can check out anytime you like, but you can never leave. So only go into the National Registry if you know you've registered previously would be my recommendation.
That is so shady. That's just like some spam mess where you randomly click on something and now you've totally cooked yourself, so to speak. Mm-hmm. I would also, I'm going to do this as well, go to like your GP and just make sure, hey, just so you know, I don't want to be on this list, because I don't even know how you would update your electronic records. I mean,
yeah, you'd have to ask the healthcare professional to put that on, like with your alerts, like with your allergies and things. They have a place for those sorts of things. Yeah, so that would be the other recommendation, but it is tricky and it's really deceptive. Here in Wisconsin, they've actually added a consent to donate to our hunting and fishing licenses. So an elderly friend of mine, he was going to go fishing, and in the old days, you'd get a fishing license and you'd sign it, right? You're supposed to carry a signed license. But now what he had signed was, I consent to become an organ and tissue donor. And his wife saw that laying on the counter and said, that's not what we want. So they had to go to some time and trouble to have that removed. So it is something that needs to be changed. We need to be able to opt out. In New Jersey, they actually do have a religious exemption to brain death. Funny, they've had that since the early 1990s, and New Jersey is in no worse fiscal state than anyone else, I don't think. So I really don't know why nationwide we couldn't have an opt-out to brain death for any reason. Because, even if you're not an organ donor, a lot of people have been burned by the brain death diagnosis, because once that's made, the hospital says you're dead and we're unplugging you. And there have been cases that I'm involved with people's children, and they just want their children to have a little more time to see if they can recover. And the hospital gets real hard-nosed. I mean, one family was escorted out by security, and the child was unplugged above their objections. I mean, so we really should be able to opt out. I mean, how come New Jersey can and people in other states not? That needs to be changed.
Are these things like state specific, I'm assuming? Because I was kind of under the blind assumption that it should all kind of be the same, but New Jersey seems to be the outlier, oddly enough.
Yeah, oddly enough, it was the Orthodox Jewish community in New Jersey in the early 90s that, disagreed philosophically and religiously with the brain death diagnosis and got that put on there. And yes, every state has slightly different brain death legal criteria. I mean, you can be dead in one state and not in another, basically. I mean, which makes no sense. So yes, it is state by state law that we're working with.
Man, so we got homework on this, and I'm going to look up North Carolina when we get off the air to make sure I'm not somehow going to be snuffed out here. Well, thank you so much. Is there anything we're leaving on the table? I know we're about coming at the hour mark, but I don't want to leave any information that you want to get out there before we close here.
Yeah, I just, I encourage people, nobody likes to think about death, and it's sort of a taboo subject, but it's important enough that we need to kind of loosen up and have these conversations and explore these things and look into what's right for you. I mean, I know we live in a pluralistic society, and my choices may not be your choices. I just think we should have full transparency and fully informed consent so that everyone can make a reasonable choice, that using the information that anybody would want to know. And I want that to be more publicly available. So please, visit the website, www.respectforhumanlife.com. Follow me on X at Heidi Klessig MD. Take a look at my YouTube channel, again, at Heidi Klessig MD, and make the decision that's best for you.
That sounds great. That sounds wonderful. Well, thank you so much, Heidi. If you'll stick around for about 30 seconds, I'll wrap things up here and say goodbye to you off the air.
All right. Thank you so much.
All right. Thank you so much for everything. Thank you. Well, folks, as always, I hope you were taking notes on that one, and definitely listen to it again. Pause it, anywhere you need to. I'm going to be taking some more notes after we get off the air here because I got to look into this a little further. So thank you so much for Dr. Klessig's time, and thank you so much for joining us, people that are out there listening to it, watching this. As I always say, you can't do everything, but you can do something. So try to get out there, do your part, make a difference, and I'll be seeing you sooner than later in the Anomic Age.
Thank you for listening to The Anomic Age, a John Age project. For past shows, further info, and to comment, go to anomicage.com. That's ANOMICAGE.com. Till next time, thank you for listening to The Anomic Age.